in our study that we did to show the efficacy and the safety of Daratumumab, we looked at the safety of rapid infusion, and we did almost 150 infusions in a multiple myeloma patient. The purpose was to increase not only the efficacy in the treatment of patients treated with Daratumumab, but also to have more efficacy and safety for the patient with the rapid infusion. So we based on the background of a previous rapid infusion done in a US study, we began to treat patients from the third infusion in 90 minutes, and we showed that all the patients that we treated in almost 150 infusions, the treatment was really safe. Most of all, we showed also that Daratumumab was efficient, and treatment was equal to the IV infusion. It was equally effective. So this is a good result.